Assumption Marshall, John O'Rourke, El Sayed, Sarah El Kathleen, Michael Stack.
A distinguished teaching institution honors its postgraduate students with its highest award, a fellowship. An image, formal and posed, records and fixes the present proud moment for the future.
At night.
The Royal College of Surgeons influences the standards of not only surgery, but also medicine in Ireland. It possesses an independent medical school where students from many parts of the world come to study medicine and graduate with internationally recognized qualifications.
In medical practice, in diagnosis and treatment.
As a postgraduate school, the college educates doctors specializing in surgery, and through its faculties of radiologists, anesthetists, and dentistry, provides training in these specialities also.
Look at the cerebral hemisphere itself.
We have a very close association with our sister colleges in the United Kingdom, Australasia, South Africa, and North America. Our postgraduate activities have expanded in recent years to include the training and evaluation of anesthetists, radiologists, dentists, and nurses.
Places in the undergraduate medical school are allocated on the basis of 1/3 to Irish students and equal proportions to developing and developed countries.
I'm from Germany.
I'm from Canada.
I'm from Nigeria.
Australia.
I'm from Sweden.
From Trinidad.
I'm from the United States.
I'm from Saudi Arabia.
Sydney, Australia. Norway.
North America.
Ireland.
We're from Malaysia. South Africa.
Egypt.
From India.
West Indies, St. Lucia.
From Saudi Arabia.
Denver, Colorado.
I'm from Kuwait.
From England.
From Mauritius.
Trinidad.
The north of Ireland.
California.
To appreciate the importance of the founding of the College of Surgeons on medicine in Georgian Ireland, we need to look back 3 centuries earlier to the foundation of the first medical corporation, the Guild of the Art of Barbers. This was a trade guild incorporating not only the surgeons, but also the barbers, the apothecaries, and the periwig makers. Towards the close of the 18th century, a number of well-traveled Irish surgeons began to voice their discontent, and they advocated a total separation from what they termed the preposterous union with the company of barbers. Following parliamentary agitation, these surgeons obtained in 1784 a royal charter for the regulation of the profession of surgery. Soon they had established a fine college hall in the centre of Dublin. Towards the end of the 19th century, the College of Surgeons joined with the Royal College of Physicians in granting a conjoint qualification. So it comes about that medical students are trained in the College of Surgeons and alternate conferrings are held in the Royal College of Physicians. Here, the presidents of the Royal Colleges are joined by the president of the National University of Ireland, which recently established the College of Surgeons as a recognized college. Graduates, therefore, receive qualifications from each of the 3 institutes.
We came to an arrangement whereby their students would take the matriculation examination which is necessary to enter the university. Their courses would be agreed by our professors in the different subjects. Their examinations will be held between themselves and ourselves with the joint examiners at all examinations up to the final and including the final medical level. And then, having passed these examinations, they're admitted to degrees in the National University of Ireland. So that every student now who passes his final examination in the Royal College of Surgeons gets the licentiate of the College of Surgeons and the MB, BCH, BAO degrees of the National University of Ireland.
If we get the feet together in the... Yeah,
Today's graduates are grouped and posed for the obligatory photograph. The statuary of Victorian Dublin's medical eminences frames the image. Before commencing the study of medicine, students must first be proficient in the basic sciences of chemistry, physics, and biology. A year is devoted to the study of these subjects. The study of medicine begins with learning the normal functions of the body through the subjects of biochemistry, histology, and physiology.
Physiology is the study of the normal functioning of the body, and it's the subject with which you begin your medical studies proper. And it's something which you will continue to be studying, not only for the 2 years that you're with us, but for the remaining...
As well as learning the normal functions of the body, the student must also be familiar with its structure. This knowledge is gained by a study of anatomy.
And it's important to be able to point that out. It's rough, a little bit behind the midway point between the frontal pole and the occipital pole. It just crosses over the superior medial border of the hemisphere. You can see that there, all right?
Following the preclinical period of anatomy, physiology, and biochemistry, the student is taught how disease interferes with normal function, the study of pathology. Throughout his training, the medical student spends as much and perhaps more time in libraries studying the theory of medicine as he does at practical demonstrations. The years of preclinical training are followed by a 3-year period of clinical teaching, during which the student becomes familiar with the diagnosis of disease in patients.
Dublin teaching has always been a very personal one, I've always felt. Good bedside teaching, the patient and the surgeon and the doctor all come together, which is much better than what's happening in many places. Modern technology is taking the doctor and the patient further apart. And for overseas students, I really do feel that good, close bedside teaching is most essential. They take that back to their own country.
I'd like first of all to thank Mr. O'Reilly for allowing us this facility, which is fairly unique in a lot of ways, that we can come and talk about his problems. So I'd like to start with you, Mr. Malone. I'd like you to take a history from Mr. O'Reilly.
The transition from books and laboratories, from anatomy room cadavers and audiovisual demonstrations, to the reality of illness in patients is made more smoothly by some than by others.
Suffering from bronchitis, and it seemed to get worse, and my breathing became affected.
Well, Mr. Cassidy knows about his illness, so we can discuss it fairly freely in front of him. He's bled twice since he last left the hospital. What are we going to do with him now?
We'd like to take him into the hospital.
How are we going to start investigations?
Assess his condition. We don't know.
The confrontation with sick people is a new experience, unique among university disciplines in that it requires not only a teacher and a student, but also the patient.
Now, Doctor, I'd like you to take this lady's history, please.
What's your name?
Mary Phillips.
And how old are you?
63.
And where do you come from?
Wicklow.
All right. Well, you're giving me a lot of things, but I want to know which one is most likely.
Exacerbation of his chronic obstructive airways disease with pulmonary edema.
Do you agree, Mr. Cotter, with that? Yes, sir. Anybody like to disagree with this diagnosis? Because I disagree with it.
Electrolytes, how will that tell you about how much they've bled? What would you do to assess how much they've bled?
The history will tell how we can assess how much blood he has actually vomited or brought up, and what colour the bleed is will indicate where the bleeding has come from.
Is the volume of blood lost, is that necessarily a good indication?
It may be mixed up with gastric secretions, so he mightn't be...
Exactly. So, and the patient will only recognize it all as blood.
Blood, yeah.
In the past, she's had 2 tuberculous glands, and she had one on the left drained and the one on the right removed. And the cervical symphyrectomy was for Raynaud's disease in the past.
And you can see the scars on both sides.
Would you like to palpate for his spleen, Matthew Goodman? How many ways may one palpate for a spleen?
4 different ways.
4 different ways. Tell us the 4 different ways.
Now, is that chest hyperresonant or normal resonance?
The chest is hyperresonant.
Can you tell me any other findings that suggest emphysema other than just hyperinflation? Would you like to make any suggestions from the end of the bed?
Well, the way that the chest moves during inspiration and expiration.
Have you felt his spleen?
Yes, I can just feel the tip just there.
How do you know it's his spleen?
Well, it moves down and touches my fingertips during inspiration.
The first thing you should give is the...
It's in the right anatomical position.
Okay, that it's in the anatomical place, but if it has a hallmark, if there is one feature which distinguishes spleen from all other organs...
It's a notch.
A notch. Did you feel the notch?
Yes.
Do you distinguish between Raynaud's disease and Raynaud's phenomenon?
Well, Raynaud's phenomenon is...
The purpose of bedside teaching is to enable the student to recognize the symptoms and physical signs of disease, and then to form a diagnosis. It takes many months of critical interchange between teacher and student before even elementary clinical competence is acquired.
Who knows the answer to that? 2, 3, 4 of you.
All right, we'll interrupt you on that now, so you've got all that you want to get. Any of the findings that we suspected that might be there, are any of them there?
No, just the heart sounds appear to be very distant.
Is that surprising?
No.
After the relative peace of the hospital wards, the students must also learn to cope with sickness in the often alarming environment of a busy accident and emergency department.
I'm just going to do a suction on it. Make it easy for the nurses and carers to remove them.
What's that?
By cutting them nice and long, stitches.
I mean, the size of the heart isn't really strong. No. Doesn't make that much difference. Your ECG show any changes? No change.
Would you get the results? I've got to go to bed.
Charlie knows what that lady.
Turning on the top. Angulation, yes.
There's a little angulation, but you started talking about displacement. How much displacement is there?
Complete.
If you put a plate on the one side and everything more in the know.
During these years of clinical training, the student is introduced to the specialities of medicine. He learns to establish that unique relationship with the patient, so essential to the good practice of medicine. In no speciality is this more important than in the illnesses of childhood, where the earliest impressions for good or bad are often lasting ones.
What's wrong, Mark?
The doctor and nurse in training learn to establish with the sick child an affinity based on trust and understanding that permits children to come to terms with illness.
The man up. Up.
Do you need a doctor to help you? Did you not got a doctor in there? I thought you had a doctor in there. Have you not? Oh, don't be biting the bandage. I can put that in the baby's leg.
This tender relationship, so fundamental in childhood, is no less important in allaying the fears of the adult patient entering hospital for the first time.
Mr. Ryan, your history and your physical examination are consistent with a blockage in one of the major vessels going to the lower limbs. And in order to relieve you of your symptoms, I think an operation would be required. Now, we would need to admit you to hospital for this to be evaluated. This evaluation would include x-rays of your arteries and a full assessment of your physical condition, including the function of your heart, lungs, and kidneys.
Oh, yes, you can sit down in the chair.
having done that, we would need to see whether you are, and I believe that you are, fit enough to undergo such a procedure. This would all be done over a few days in the hospital. Now, this being a teaching hospital, whilst you're in hospital, with your permission, I would like to bring along some of my students and doctors in training to discuss your problems and the way in which we intend to manage it. You will find this, I would think, of considerable interest.
I might expect to find diminished pulses in his legs.
Where?
Throughout his leg.
Throughout his leg?
From the feet and proximally as well.
Right, thank you, Miss Walsh. Now, Mr. Jabber, with this history, how would you investigate this patient?
I would do arteriogram to see if there's any occlusion or narrowing of the vessel that would impair the blood flow to his limbs.
The most significant lesion is in the pelvic vessels with this very severe critical stenosis in the common iliac vessel on the left side. He also has considerable disease in the other pelvic vessels, but the stenosis is localized and marked on the left side.
Can you see the inferior mesenteric artery there?
I can see the inferior mesenteric artery, and I assume that it is lightly occluded.
So these runoff vessels look good, and we presumably therefore could look forward to a good technical result.
The teachers of the Royal College of Surgeons and its hospitals not only train medical students over their 6-year apprenticeship, but also doctors in a number of postgraduate specialities, foremost among which is surgery.
Both iliacs being involved at different levels.
Often undergraduate and postgraduate training go hand in hand, especially in learning at the bedside and in the operating theater.
I think a bypass graft would be the most reasonable option in this man.
The advances that make possible a major surgical procedure represent the culmination of centuries of learning and inquiry. How did surgery reach this stage of development? Medical knowledge had its earliest origins in the study of human anatomy. This self-image was drawn by the 15th century artist Albrecht Dürer to show his physician where he felt pain and to assist in the diagnosis of his ailment. In the 16th century, the famous anatomist Vesalius swept aside the Galenic superstitions which had stifled the advance of medical science for nearly 1400 years. In a series of sumptuous plates, many of which are ascribed to Titian, the anatomical majesty of the human body is revealed. Vesalius brought to the study of anatomy a respectability that it previously lacked, and he transformed it from a superstition to a working science. The great teachers of medicine were to remain preoccupied with the structural rather than the functional derangements of disease. So it was that anatomy became the cornerstone of medical teaching. More than a century was to pass before William Harvey demonstrated the circulation of the blood in his famous De Motu Cordis. Medical inquiry now turned its preoccupation with structure to an appreciation of function. However, the practice of medicine and surgery remained primitive and was largely uninfluenced by scientific advance. As knowledge accumulated slowly, the superstitions of centuries were dispelled. The dissemination of this knowledge throughout Europe was facilitated by the increasing availability of books. There were great European medical schools at Padua, Montpellier, Paris, and at Leiden, where many Irish doctors were trained by the influential teacher Boerhaave. The outcome of surgery was often fatal. The chief causes of death were infection, collapse from blood loss, and the pain of the operation without anesthesia. Whatever slim hope there was for success depended on the speed and dexterity of the surgeon. which in turn depended on an intimate familiarity with the anatomy of the human body. As there was little supervision over the training of surgeons, it is scarcely surprising to find them the subject of many satirical cartoons. The presence of the public in the anatomy theaters at the dissection of criminals' bodies provided a spectacle that attracted many great artists. In Dublin, these European advances in medical science did not pass unnoticed. Young men seeking medical education traveled abroad, and many established reputable careers in foreign countries. Those who returned to Ireland brought with them European books, and more importantly, new ideas. The University of Dublin had been founded at the close of the 16th century, and in collaboration with the Royal College of Physicians, founded in 1654, granted medical degrees. Dublin was without a hospital for nearly 3 centuries after the suppression of the monasteries. The misery of the sick poor, especially in the city, was unrelieved until 1718, when 6 surgeons founded the Charitable Infirmary, the first voluntary hospital in the United Kingdom. 6 hospitals funded by private subscription opened in Dublin before the close of the 18th century. In 1733, Dr. Stevens Hospital was built with monies bequeathed by Richard Stevens, but it was due to the selfless energy of his sister Griselle that his last wish was fulfilled. A social awareness was being created by charitable people. Doctors and their families who are best placed to witness the condition of the sick poor were often the founders of these hospitals. 2 years after Dr. Stevens opened, Mary Mercer, the daughter of a Dublin doctor, gave her house and lands for the foundation of another hospital. In 1745, Bartholomew Moss founded the Dublin Lying-In Hospital for poor women, the Rotunda Hospital. In 1784, the Royal College of Surgeons was granted its charter, and in 1810, the new medical school was built. The organization of surgical training and practice was now underway. The college flourished in its early years, partly because of the demand for surgeons for the Napoleonic Wars. Many doctors were qualified speedily in private medical schools for hasty dispatch to the battlefield, where it was hoped they might at least provide rudimentary care for wounded soldiers. Anatomy remained one of the primary subjects of medical education. Though the law demanded that all doctors have a knowledge of anatomy, it permitted the dissection of hanged criminals only. This was the era of body snatching. As the demand for bodies greatly exceeded the supply, the sack-em-up men, or resurrectionists, were often joined by the medical students in raiding graves in search of bodies for the dead room. The lessons learned in the anatomy theater were of little benefit to the hapless patient. Without anesthesia, the pain of surgery was quite terrifying, and the surgeon needed not only dexterity and a knowledge of anatomy, he also had to have nerves of steel. Without effective means of blood replacement, many patients died of shock. The greatest killer of all, however, was infection, and major operations invariably proved fatal within days. For the patient, the attempted cure was often worse than the disease, and their suffering at the hands of the doctor unbearable for us to even contemplate. Dublin medicine kept abreast of progress in the hospitals and universities of the European capitals. The reputation of the College of Surgeons was being firmly established at home and abroad. A notable advance was the founding of the Royal City of Dublin Hospital in 1832, especially for the clinical teaching of surgery. Primitive though practice was, there was to emerge a renaissance in medical thought, which became known as the Dublin School, and through which Dublin was to attain an international reputation in the middle years of the 19th century. The Dublin School came about largely because of the energies and talents of 3 remarkable physicians. Robert Graves rebelled against the doctrine of his teachers and peers by advocating nourishment rather than starvation in illness. Assisting him in these reforms was his younger colleague, William Stokes, who introduced the stethoscope to Ireland. Both Stokes and Graves worked in the Meath Hospital. As well as being a physician, Dominic Corrigan was also a Commissioner for Education, Vice-Chancellor of the Queen's University, and a Liberal Member of Parliament for Dublin. In the charitable infirmary, he described the disease of the heart which now bears his name, and he later moved to the House of Industry Hospitals, where he directed relief operations during the Great Famine. The members of the Dublin School travelled abroad frequently, and, returning with new ideas, they achieved for Dublin a reputation that attracted distinguished doctors and medical students from Europe and America. They replaced bleeding, purging, and starvation with careful nourishment and judicious treatment, and established the tradition of bedside clinical teaching for which Dublin is renowned. Similar advances were occurring in surgery. In Boston in 1846, ether was first used for anesthesia, and within weeks, a girl's arm was amputated without pain in the Richmond Hospital by John McDonnell. And with the discovery of bacteria by Pasteur and the antiseptic remedies of Lister in 1865, the surgeon was enabled to operate without inflicting pain, knowing that sepsis would not soon afterwards kill his patient. Other reforms were taking place in the administration and design of hospitals, and Florence Nightingale was bringing to nursing the discipline and organization that it previously lacked. The ultimate beneficiary of medical science is the patient, as William Moran of Molan's Cottages, Dublin, acknowledged in a letter to his doctor in 1858. My most sincere and heartfelt thanks to you for returning to me the hand which some time ago I wanted you to take off, but thanks be to God and you, it is now quite well, and I am able to earn my bread with it. Towards the middle of the Victorian era, illustrations of patients attending Dublin's hospitals began to show the benefits of scientific advance. Great though the advances were, there were still many illnesses outside the reach of medical cure. The dramatic effects of social reform and improved sanitation on health were only beginning, and the era of antibiotics was to belong to the 20th century. At the turn of the century, the improvement in hospital practice is reflected in the images of patients, nurses, and doctors posed in formal groups for posterity. In the theater, where once the patient and the surgeon were the main characters, a team is seen to come together. The surgeon, his assistant, the anesthetist, students, and nurses. In 1895, Wilhelm Röntgen gave to medicine its most valuable image, the X-ray. From this discovery, a host of new specialities arose. Radiology, orthopedic surgery, gastroenterology, cardiology, and neurosurgery all depend on the technological refinements which originated with Röntgen's discovery. The application of the computer to radiology and the use of radioactive isotopes permit visualization of almost every organ without discomfort to the patient.
Newer techniques include ultrasound, which utilizes high-frequency sound waves, or radioisotopes, in which radioactive tracers are injected into the body and recorded on cameras outside, or computerized tomography, in which thin transverse slices of the body are taken by X-rays and reconstituted by a computer.
I think it's desirable, even in
these advances have made possible the complex surgical operations of today.
Now just slip that between your thumb and index finger there for a second.
The success of modern surgery no longer depends on the skill of the surgeon alone. Rather, it is the close cooperation of a team of highly trained personnel that ensures the successful outcome of a major operation.
Now if you would cut those. And suck in the middle there, in the lumen of the artery there, Simon, please. That looks good now.
The most important postgraduate role of the College of Surgeons is the maintenance of standards in surgery. A surgeon in training spends much time in the study of anatomy, in the wards, and in outpatient departments. But acquisition of surgical skill can only take place in the operating theatre.
Now, if you can feed it in full to me as I did to you. Scissors, please. All right? Happy enough about that. Now, let's have a look.
Improved anesthetic techniques have been one of the major advances of this century. In the College of Surgeons, the Faculty of Anaesthetists organizes postgraduate training for its doctors. And, as with surgery and radiology, the award of a fellowship marks the completion of specialization.
Okay, you just hold your hand with it. Thank you. I'm just going to flick that over that way. I'll take one or two.
An operation depends to a great extent on the skills of the nurse. And as the discipline of nursing expands, the responsibilities taken on by the nurse increase.
The level of training of the nursing faculty must reach the same high standard as all the other faculties. Nursing discipline complements the medical disciplines. Therefore, the standard of education training must be at the same level. Nurses are caring for patients. They must therefore understand the patient's needs. In order to do so, they must have a nursing and medical knowledge of a high level in order to give the best patient care.
We do require some dietary cholesterol.
Another aim of the faculty is to motivate nurses to continue studies in order to build up a body of knowledge which will help them to be of more benefit to the patients they are nursing.
Exercise.
Yes, indeed, exercise is...
Medical research has contributed greatly to the alleviation of suffering. The College of Surgeons allocates a substantial amount of funding for research to its academic departments.
About 95% of all drugs in use today were discovered in the past 40 years. This means that these drugs were not alone synthesized, but were also applied in the clinical setting, and this is important clinical research. The second major justification for research in this school is that it's important for the scientific training of individual graduates, that they can expand their knowledge of the scientific method and to appreciate the scientific method. And this will equip them for going into leadership roles, not alone in this country, but in other countries throughout the world.
This is a 73-year-old.
Though the College of Surgeons is situated in Dublin, its fellows are dispersed in the regional and county hospitals throughout Ireland, where the maintenance and improvement of standards in surgery is a major objective.
The Royal College of Surgeons has a continuing commitment to set and maintain the standards of surgical training throughout the country as a whole. This doesn't just apply to the Dublin centres, but applies equally to the various centres, particularly such as Belfast, Cork and Galway, but also applies to the county hospitals where surgical training is carried on. That's right.
The reputation of an institute, apart from its teaching, apart from its clinical work, depends very largely on research output, and this is important for our reputation domestically, but of course it's also very important from the point of view of our international reputation.
There's no doubt that the influence of the colleges and institutions such as this throughout the past 200 years have really led to the development of the place surgical training on a very high level of performance worldwide.
The college acts as host to many international meetings and conferences, where it welcomes distinguished guests from at home and abroad. One topic often considered is how to choose the doctor most suited for surgical training.
The Royal College of Surgeons in Ireland has looked at this a good deal to decide how best to make that assessment of a man who wants to be a surgeon and has been trained, how best A, to train him, and B, to assess him at the end of that training.
The college has strong links with the Middle East.
It introduced, of course, a standard, and it helped our faculty to learn about the techniques of examination for the primary fellowship.
Except in the Royal Colleges, there's perhaps not enough exchange. Our requirements in the United States are maybe no more severe, or certainly one can't say they're better or worse, but they're different.
I mean, if they go ahead and process it all now.
We enjoy sending our residents here to practice in a different cultural environment and to have an opportunity to see that medicine can be practiced effectively in a different way. We, in turn, I think, have something to offer your people coming to our place in the way of research techniques and the approach to research. And, of course, they profit from the clinical exposure, too, where the thinking and the approach to problems may be somewhat different.
The fact that all Royal Colleges are independent of funds from government and so forth means that they can make their decisions about training and what they regard as preserving the highest standard of practice, which is really the ultimate safeguard for the patient. So that independence is absolutely vital.
Well, over the 50 years that I have been here, certainly I have seen a tremendous amount of change. At one time, I would have said that this college was really the Cinderella of the Royal Colleges. Partly due to money, partly it was very parochial. Today, we really are in world surgery. This is, I think, a great deal due to the excellent work done by our recent past presidents. We've now links with Pakistan, Saudi Arabia. Some years ago, Norway actually had no place for students. And out of the 43 medical colleges, universities, in the three kingdoms, they chose Dublin. In this year of 1984, which is the bicentenary of the foundation of the college, we will have 14 honorary fellowships given that night with people as wide apart as Russia, South Africa, America, you name it. Everybody will be here.
Dignitaries from home and abroad come to celebrate the 200th anniversary of the college. Among them is the President of Ireland, Dr. Patrick Hillery, himself a fellow of the college, and his wife Maeve, also a doctor. The college anthem is the music of a song recalling the love affair of the first honorary fellow, Robin Adair. The procession for the bicentenary award of honorary fellowships is led by two fellows, each bearing a barber's pole to commemorate the former link with the barbers.
It is the opinion of this committee that a royal charter dissolving the preposterous and disgraceful union of the surgeons of Dublin with the barbers and incorporating them separately and distinctly upon liberal and scientific principles would highly contribute not only to their own emolument and the advancement of the profession in Ireland, but to the good of society in general by cultivating and diffusing surgical knowledge.
I, Ian Alexander McGregor.
I, Fritz Lindert.
I, Michael Cousin.
I, Geoffrey Slaney.
I, Mervyn Smith.
I, Henry Bonson, do solemnly and sincerely declare that I am 25 years of age and upwards.
And that I will observe and be obedient to the statute, bylaws and ordinances of the Royal College of Surgeons in Ireland.
And that I will, to the utmost of my power, endeavour to promote the reputation, honour and dignity of said college. And that I do not now practice the business or profession of the apothecary or druggist, or indirectly sell drugs or medicine.
And that I will not, so long as I shall be a fellow of the said college, practice such business or profession.
By virtue of my office as President, I admit you a Fellow of the Royal College of Surgeons in Ireland.
the ceremony's over, a record of the occasion must be made. 200 confident years have ended tonight. The image of this celebration will be preserved in a formal group photograph posed under the portraits of an earlier age.
Hold on, I give this back for you. Hold on. I don't worry. Hold it, please. Thank you. Now, okay, I'll tell you when. Right back.
The past has now begun. The future will create its own image.